Hello and welcome to the 1895 podcast with me, Tom. Just me today. Rob is unable to join me on the podcast, so we'll catch up with him again next week. But we've been saying for some time now that we want to shine a light on the medical oxygen industry on this podcast, so that's just what we're going to do today. This is, of course, a topic that sits at the intersection of industrial gases, healthcare, and social impact itself, and is perhaps something that many of us can take for granted. But as the COVID-19 pandemic, which was just over 5 years ago now, made painfully clear, is that access to reliable and affordable medical oxygen is still very much out of reach for millions of people around the world. And recently, I had the chance to discuss this very topic with Mark Adkins of LeanMed to talk about how his company is trying to close this gap. So let's get into this conversation. Mark, welcome to the podcast. Thank you so much for joining me today. Perhaps firstly, though, for the benefit of the listeners who may be unfamiliar with you or may be unfamiliar with LeanMed, then please tell us all about yourself and what inspired the founding of the company.
Well, Thomas, thank you for having me today, and it's my pleasure to be here with you. My personal background for most of my career has been new product development. It's always been something I've loved to do and have worked at it hard over a number of decades, actually. And so where the LeanMed story begins is I was teaching at the University of Pittsburgh a course called Managing Medical Product Innovation in the graduate bioengineering program. So I was teaching students there on how to develop medical devices. And one of my students traveled to Malawi and came back to me in 2018 and essentially said, Professor Adkins, 1 million children will die this year from pneumonia. And as an American, I argued with him and said, well, no, that can't be. You get sick from pneumonia, but you don't die. Well, that was my mistake. Now, the fact was that in that year, 1 million children did die. And James Newton is the student's name, or he's a doctor now. But he wanted to form a team. So we formed a student team. I was the mentor. And pretty rapidly, when we did kind of a root cause analysis, we came to the conclusion that it was medical oxygen that was missing for so many of these children. So we came up with the idea of a solar-powered medical oxygen system and we called it the O2 Cube, because when we did a mock-up of it in my garage, it kind of had a bit of a feel of a cube. So we called it the O2 Cube. And in that year, we entered a University of Pittsburgh competition, and we took first prize and won $10,000. And with that $10,000, we started the company in May of 2018.
Fantastic. No, that's a great introduction to yourself and to LeanMed. And, it really emphasizes that gap in medical oxygen that we do still see, but that gap that you're trying to solve at LeanMed. So I'll get back to the technology in just a moment, but to, I guess, overarch this whole conversation, why do you think that oxygen is still so inaccessible for so many parts of the world, especially following on from the COVID-19 pandemic and given how essential oxygen, of course, is?
So despite the fact that COVID brought awareness and there was a lot of money, hundreds of millions of dollars during those COVID years that were put into the low to middle income countries where the need was so great and so many people were dying. The problem, frankly, the dilemma, and we still have it today, and what we're trying to overcome with the O2 Cube, is that the tools or the devices available were oxygen concentrators and PSA plants. And those technologies, those products have been around for 30 years or more. And in this case, they were applied. They brought relief to many people. There's nothing wrong with either one of those technologies. But in my opinion, what was missing was an innovation. And this is where I think we've tried to be different and tried to really bring innovation to solve this problem. And that's where the O2 Cube comes in. Because the O2 Cube, essentially the vision for where we're going, is we want it to be cloud connected, it's solar powered, it's on site at the healthcare facilities, medical oxygen production and storage. So that's our value proposition. And when you look at some of the barriers, and I've published this on LinkedIn, I've written about the 7 barriers to the deployment of oxygen to this last mile. We call it the last mile, these billion people that are living without oxygen today. And when you look at some of the barriers, some of the most significant are a lack of grid electricity. It's either non-existent, unreliable, or very expensive. So that was one big challenge to overcome: grid energy. The second major obstacle is the roadways. Today, these more remote, and they're not remote like out way up on a mountaintop, but you just have to go 100 miles outside these city centers. And the hospitals that are trying to operate outside those city centers, the only way they get their oxygen is delivered on diesel trucks, big tanks of oxygen delivered on diesel trucks. And so that's also a barrier. So now think of the O2 Cube. It's sitting at the hospital. It's solar powered. It's not dependent on the grid. And there's literally no transport required. The oxygen is produced on site where the patients are. So that's really where I think our innovation is going to help us overcome, this last mile dilemma.
Right, and that's a great description and a great vision of what the O2 Cube looks like and what it does. So how does this differentiate from, other oxygen delivery technologies? You mentioned a few there, PSA, compressors. What makes the O2 Cube different to these?
I think what we did, we leveraged Philips. So Philips Healthcare was headquartered, their respiratory business was headquartered in Pittsburgh, where I was teaching at the university. And I knew the folks there. I'd done some work with them. And I knew they had discontinued what they called their ultrafill product line. And that was designed for American and European homes to fill cylinders in the home of, for example, a COPD patient. They had discontinued that line because essentially it had been disrupted by the development of portable oxygen concentrators that people could put a backpack on their shoulder and they could move and have mobility using portable oxygen concentrators. So the need to fill a tank in your home had really diminished quite a bit. So they made a business decision. They got out of that business. But that ultrafill home compression technology was there. So we went to them, we licensed that, and then we took that ultrafill product line and through, again, I'll call it innovation and engineering, we moved it from something that was intended for an American home, and we designed it for a small African hospital. And that's what we're doing today with systems operating in Nigeria and Uganda. So it was through innovation, product development, that we are overcoming those barriers by leveraging an existing technology.
Sure, and what you've just said leads nicely into my next question as well. On your operation, what projects do you currently have underway, and where is the O2 Cube being used right now?
Right. So we have 2 really excellent success stories, two customers of ours, Healthport in Nigeria and Afia in Uganda. And both of them are startups, young companies that are employing a business model called oxygen as a service. So in this case, they own the O2 Cubes. The hospitals don't. Healthport and Afia purchased the O2 Cubes from us, and they operate the O2 Cubes. And then they have contracts with hospitals to deliver the oxygen and guarantee that there's a steady supply of oxygen daily to those hospitals. In addition, in particular, Healthport in Nigeria, they were founded by a woman, Dr. Aisha Adeniji, who's a nurse by training and background. So that HealthPort also employs clinical staff. So and this is important, I want to talk about, what we've learned and what HealthPort has done in Nigeria. So many of these hospitals operate with oxygen as a scarcity mentality. So they find themselves rationing oxygen out to those patients that absolutely have to have it. And unfortunately, that puts them in this situation sometimes of having to decide even who lives and who dies. Once you remove the scarcity, once the hospital staff knows that oxygen is plentiful, it's available, we don't have to ration it any longer, and they're properly trained in pulse oximetry and how to prescribe oxygen, the demand actually goes way up for medical oxygen. So that's what HealthPort has done, is probably the best example of, yes, providing the oxygen every day that's required, but removing that scarcity mentality. And it's a wonderful thing because it means more patients are getting treated properly.
Absolutely. And the more patients that are receiving this oxygen, of course, it's always going to be better. How do you decide where to deploy the O2 cube? Is it, I don't know, community needs, data driven? Is there partner interests there?
Well, in this case, it's really building a marketplace, right? So as an entrepreneur, as someone who teaches about lean startup and how to start up your business, in some cases, if it's a new product category, which is what the O2 Cube is, it's really something different than what exists today. You have to build a marketplace. So to be honest, we go where the market is. We're installing a system today in Tanzania. So we have a customer there that actually is a hospital on an island in Lake Victoria. Their oxygen today supply is by boat. So all of a sudden now, if you're using solar energy and you can produce your oxygen on site, that's a wonderful thing. And I just returned from spending a week in Nairobi, and I think I'm pretty optimistic that we'll soon have some installations in Kenya. So part of the job of an entrepreneur, particularly when it's a new innovation, you have to build a marketplace. So we'll kind of go anywhere and work with anyone who has a need for medical oxygen.
Great. And what does the deployment timeline look like? I know there's not always a black and white answer, but from identifying a site to having that oxygen flowing, how long does that take?
Well, so that's another one of the barriers that I articulate in that article about the 7 barriers to bringing oxygen last mile. And again, not a knock on PSA per se, PSA plants, but they're larger installations. There's a high degree of lead time that from the procurement to the build to the installation. What we've done with the O2 Cube, it's a standard product. We have a build plan that we can build to. So depending on the inventory situation, an O2 Cube can be installed in a couple of days. I mean, that's the vision. We're not at scale yet, but that's where we're going to get to. So that, if a need is identified and a contract can be agreed upon, the O2 Cube goes in, the solar panels are mounted on the roof of something, and in a day or two, you're producing medical oxygen. And that's I think one of the exciting things going forward when the world recognizes that we don't have to wait months to get our oxygen. We can get an O2 Cube in and get it up and running in a couple of days.
Sure. And I guess from one challenge to another that I perhaps see is, how would you deal with the issue of maintenance? This is, of course, something that PSA plants and a lot of them that were brought online during the COVID pandemic have had to deal with. So how do you deal with that?
Yeah, so again, this is where kind of innovation and design comes in, industrial design. We designed it to be easy to operate. So essentially, once it's installed and power is coming from the sun right through the solar panels, there's essentially, you connect the cylinder, just screw the cylinder to the outlet, and then it's 3 buttons, power on, concentrator on, start filling. and that's it. So operationally, it's intended for essentially almost anyone to be able to operate it. And then from a maintenance standpoint, one of the really wonderful things about the Philips design, that when they were designing it for the home, they had, kind of a home environment, and the user was going to be someone, a COPD patient at home. So it's quiet. It's very low power. It's one of the secrets that we have. And what enables us to drive this through solar, the compressors themselves are very low power, and also they're long life. So the lifetime is essentially double what you see for most compressor or booster systems in PSA plants. So there is regular maintenance required in terms of filters, but it has a longer life and a lower power consumption, and that enables it to also be easy to operate and maintain.
Right. And to just touch on deployment a little more, but how do you work and grow your deployment? Are you directly in contact with governments, NGOs, and I assume there must be a challenge of financing here as well?
Yeah, so again, the reality is, and I'm going to talk mostly to Africa because that's where we're operating today, although anything that we talk about could be applied to South Asia or to Latin America as well. But those governments essentially are relatively poor versus the global north. So they rely a lot on the NGOs for funding. So it really means, as LeanMed and as a proponent for the O2 Cube, we're talking to the NGOs. We want them to believe in what we're doing and fund it when appropriate. We have to have the buy-in of the ministries of health that run the public hospital systems, because they're going to be the owners and the operators of it. We also work with the faith-based organizations as well. So within Africa, many healthcare facilities are not public, but they're faith-based networks, and so we talk and work with them. And then the fourth stakeholder really are these oxygen as a service providers like HealthPort and like AFIA. And it's my hope that we're going to see more and more of these startups come along and say, you know what, in my community, I would like to be in the medical oxygen business. I would like to provide oxygen because it's a need. So I hope with the right funding and financing, we can proliferate, not just bringing the oxygen, the medical social impact, but I'd love to see an economic impact that we're spawning hundreds or thousands of entrepreneurs throughout the world.
Sure. And what's next for LeanMed, I guess, both in terms of scale and geography as well, because this is something that you want to get out to as many people as possible, isn't it?
Correct. So in this stage, we're essentially in a pilot stage, I'll call it. It's probably the best term, in that we're building them in the United States. We're not at scale. It's not the most economically attractive way to do it, quite honestly, if your deployments are in Africa. So it's from the beginning, the intent has been to manufacture the O2 Cube in Africa. So many of these conversations that we're having about procurement of the O2 Cube, we're also talking to those groups about, can we establish a manufacturing operation in Africa to help scale? What else we need to do to move forward? We're going to need what we call our Gen 2, because today the units that we build in the United States, they're based around the Philips UltraFill product. And when we licensed the technology from Philips, we also bought the inventory that was available. But that's a finite number of systems. So we will exhaust that supply. So we're going to do what we call our Gen 2 design. And that will free us up from the use of the Philips UltraFill. We'll still use the Philips technology, but we need to establish the manufacturing of those compressor systems. So going forward, African manufacturing, Philips compressor manufacturing that we control, and then finally we want to produce at scale. And to me, that means hundreds of O2 cubes a month. I mean, that's the market. Just because it's in my mind, I was just in Kenya when you look at the target market or the target users for this product, for the O2 Cube, in Kenya, they have levels of healthcare from level 6 being the largest hospitals to 5 to 4, and then levels 3 and 2. In Kenya alone, there are 2,500 level 3 hospitals and over 8,000 level 2s. And many, if not most of those hospitals have a very, let's say, unreliable and or expensive supply of oxygen. So just in Kenya alone, I envision hundreds of O2 cubes being deployed. And so we need to scale up, and that's really where we're headed, is, building the O2 cube at scale to meet the needs of nations like Kenya.
And that'd be great to see. Looking at the wider industry now, just to spend a few minutes on that, do you think that medical oxygen is getting the attention it deserves post-pandemic? Of course, you were founded pre-pandemic, and we all knew the need of medical oxygen during those years. But do you think there is still work to do 5 years on?
Oh, absolutely. I think one encouraging sign was announced at the end of last year. There was this global oxygen alliance formed with organizations like UNITAID, WHO, UNICEF, Global Fund, and they announced a target to raise $4 billion over the next 5 years, specifically around medical oxygen infrastructure. So it's my hope, and what I work on kind of every day is I hope that money is raised. I hope it's deployed effectively, and it's my belief that the O2 Cube, that we will garner some of that funding. I'm struggling to put the right numbers on it, but at the price point of an O2 Cube, $100 million will go a long way, which would be just a fraction of. They've announced a $4 billion raise. We could do a lot of great work with $100 or $200 million. We could serve literally, millions and millions of people with O2 cubes. So I want to believe it's getting attention. But the truth is, it's got to get down to the ground, right? It's got to get into deployment. It's got to get into the hospitals. It's got to reach the patients, and that's where it's yet to be proven that that's going to happen. But I want to be a part of that. We want to be a part of that, and I hope I truly, for the good of the billion people that don't have medical oxygen today, that we need to make that happen.
Absolutely. And you've touched on a few stories today. You've no doubt visited a number of communities that are in desperate need of medical oxygen. You've given us a few examples over the course of this conversation. But is there a particular story that stands out, in the field that has really encapsulated the work or the mission of LeanMed?
Well, there's actually the first one, which still means a lot to me. This was in 2021 when, we were in the depths of COVID, and we were still early in our prototyping and our work, right, at the University of Pittsburgh, right, and in my garage. But I met Dr. Aisha Adeniji, and we wanted to do something, so we called it our fast track. We were like, let's get oxygen in the field. Let's do something. And so we went to Philips, and we got them to donate an oxygen concentrator in one of these ultrafills that we now use every day in the O2 Cube. And then I went to the company that makes the Yeti, which is a solar powered, it's a commercial device that people use in campgrounds and RVs, where they set up their solar energy, and they can take, DC solar and run AC devices. And I got them to donate equipment, and Dr. Adeniji identified a pediatric ward in Oda, Nigeria, that had no oxygen, right? 26-bed hospital for kids, pediatric ward, never any oxygen. And if I remember properly, she said the month that she was there, because she's from Nigeria and she was back home, spending time, and that's when she identified this pediatric ward. There had been 7 deaths in just that one pediatric ward that month. So we arranged to send our fast track unit to this pediatric ward in Oda, Nigeria. And, again, in a day, it got up and running. And I still have hanging in my home, I got a photograph back, of a child on a bed, getting oxygen with one of our cylinders. I recognized one of our oxygen cylinders. So I still have that photograph hanging on my wall, and it meant a lot to me. That was the first kind of real connection, of the work that we'd actually been working on for a couple of years. But finally, here it was, a child being treated in Nigeria with one of our O2 Cube systems.
And no doubt,
it meant a lot.
Yes, and no doubt very, very rewarding for you and all the hard work that you had put in. Finally, to wrap up this conversation, Mark, if you had a message to our listeners today, if they wanted to get involved, support the work you're doing, what would be your message to them?
Gosh, I think what I hope is that they would encourage, if they're working with any of the NGOs, the big, nonprofits, please encourage them, if they're not aware of the O2 Cube, to take a look at it. And if there's funding available, again, unfortunately, that's almost what it seems to always come back to. We have a solution, but there is money required to build and ship and deploy these systems. So I would ask people to, if they work with these NGOs like a WHO or a Unitate or Global Fund, to make sure that they know the LeanMed and the O2 Cube story. If your listeners, are living in Africa and working with their ministries of health or their faith-based organizations, please, promote and make sure they know about the O2 Cube. Because I think, and maybe in a final way, again, it's vivid to me. I just got back from Nairobi. All it takes, I can sit down with someone on the front lines, a biomedical engineer, a hospital administrator, a Ministry of Health official. And I'm telling you, in 5 minutes, when I describe what we're doing and I talk about solar powered on-site oxygen production, they get it, right? So I think it's just kind of getting the word out and maybe getting some money to back it up. That would be my message.
Fantastic. Well, it's been a really interesting conversation we've had here today, Mark, and a story I'll no doubt be following in the years to come. And perhaps we should have a catch up again later this year, maybe over on one of our webinars, to see how things are going there.
That would be fantastic, Thomas. And again, thank you so much for this opportunity to kind of tell our story and maybe raise the visibility about this, again, the billion people that are living today without access to medical oxygen. It's an important mission that we're on.
The pleasure really is all mine. Mark Adkins, thank you so much for your time. And that was my conversation with Mark Adkins of LeanMed. A really powerful reminder of both the challenges and opportunities around medical oxygen worldwide, I think, and also a reminder of just how critical medical oxygen is, not only as a product line within the gases business, as we used to talking about at Gasworld and on the 1895 podcast, but as a lifeline for hospitals and patients around the world. And I think what stood out for me the most is the idea of moving past scarcity. Still, in far too many hospitals and countries around the world, oxygen is still rationed, and that means doctors and nurses are sometimes forced to make impossible choices. But solutions like the O2 Cube, as we discussed, can help remove that scarcity, and when they do, the demand naturally rises because more patients finally get the treatment that they do need. So a really interesting conversation, and we will of course be keeping across the medical oxygen topic at Gasworld. We have a webinar dedicated to just that on November 21st, where Mark will in fact be joining our expert panel, and you'll be able to ask him questions yourself during our Q&A. So do be sure to register for that. That's free on gasworld.tv, and this is something I would like to return to again on the 1895 podcast. I'm sure there's plenty of guests out there that we could talk to about the medical oxygen subject itself. So let's do that in the future. But that is enough for today, I think. We're very quickly approaching our North American CO2 Summit, so keep an eye out for plenty of content surrounding that event and North American CO2 in general. But before we take off for Denver for that event, I'd like to focus our next episode of the 1895 podcast on Canada and its place in the industrial gases business. Maybe that's something we can pick up next week when Rob's back as well. But thanks for listening. Do be sure to like, follow and share the 1895 podcast, and we'll be back again next week.